administering your alcohol flush, changing your needle-free device, and dressing. These procedures have been developed from current evidence in order to preserve vascular access and prevent infections and occlusions. When you are performing line care, an aseptic technique should be followed precisely at all times. Alcohol flushes are administered once a week to maintain the patency of your line. Please note, in some patients where recurrent infections have occurred, alcohol flushes may not be appropriate and an antibiotic lock may be used as an alternative. The dressing should be changed weekly or sooner if loose, wet or soiled. The needle-free devices should also be changed weekly. In order to administer your alcohol flush, then change your dressing and needle-free device, you will need the following items: a trolley and large Clinell universal wipes, a dressing pack, 2 10ml sodium chloride posi flushes, 1 10ml syringe, 1 red blunt fill needle, tape, 1 10ml alcohol vial, 20%. You only need 5 mils of this. 2 pairs sterile gloves, 6 small Clinell wipes, 1 Curos port, 1 needle-free device, 1 dressing, alcohol gel, 1 Chloroprep 3ml wand, 1 apron, carer only. Once your equipment is gathered, alcohol gel your hands. Place some large Clinell wipes on the trolley. Wash your hands fully using infection control procedures for hand decontamination. Use the large Clinell wipes to firmly clean over each surface using an S-shaped movement from top to bottom, only once. Allow trolley to dry. Put on apron, carer only. In order to keep the dressing pack sterile, open the packaging without touching the insides and drop it onto the trolley. As you are about to touch a sterile item, alcohol gel your hands. Create a sterile field by opening the dressing pack using only the corners. The Curos port is not sterile at this point. Clean it thoroughly for 15 seconds with a small Clinell wipe before dropping it onto the sterile field. You will also need to clean the alcohol vial. Take a small Clinell wipe, wrap the wipe around the vial, cleaning for 15 seconds before dropping onto the sterile field. You can now open the rest of the equipment, placing them onto the sterile field. Now expose the Broviac line. Assess the line site for any signs of infection and report any concerns to a member of the parenteral nutrition team. Attach tape to chest. A full hand wash is now required. Now dry your hands thoroughly and put on your sterile gloves. Open up your small wipes and sterile drape to make them easily accessible. Hold a wipe in each hand. Use one wipe to hold up the line. Use the other to clean down the line, including the clamp. Only touch the line with the wipes. Disconnect the giving set. Discard set and wipe. Use a clean Clinell wipe to clean the end of the needle-free device. Scrub the hub for 15 seconds and allow to dry for 30 seconds. Keeping the line elevated, attach the sterile drape to the chest. The line can now be dropped onto the sterile drape. Discard the Clinell wipe. Pick up the first posi flush. Expel airlock in syringe and then attach to the needle-free device. Unclamp the line. Using the push-pause technique, flesh the line. As the last 1 ml is being flushed, close the line clamp to provide positive pressure. Discard syringe. Pick up the empty 10 ml syringe and needle. Attach needle to the end of the syringe and draw up 5 ml of alcohol. Remove needle and attach syringe to the needle-free device. Unclamp the line, flush slowly over 2 to 5 minutes. Then clamp the line again. Discard syringe. Remove the needle-free device and using a clean Clinell wipe, scrub the end of the line for 15 seconds and allow to dry. Attach the second saline PosiFlush to a new needle-free device. Expel the airlock and push until saline is seen dripping from the end of the needle-free device. This is called priming. Attach to the end of the Broviac line and flush again using the push-pause technique. Clamp the line as the last 1 ml is being flushed and discard syringe. Place Curos port onto the end of the line. Now peel off your dressing and discard. Remove your sterile gloves. Put on your clean pair of sterile gloves. Activate ChloraPrep wand by squeezing wings together. Clean the Broviac line site in a hashtag motion. Allow to dry for 30 to 60 seconds. Place new dressing over the line, ensuring the site is visible. Remove gloves, discard waste, wash hands.